Hello, this narrated PowerPoint is going to help you to walk through the weight-based heparin protocol orders, which begin with the bolus dosing, the IV continuous infusion, and then we'll step through a few 6-hour PTT adjustments. Okay, so just taking a quick look at the orders, beginning right at the top, it recommends discontinuing any heparin or Lovenox. That is going to be most likely sub-Q heparin or subcutaneous Lovenox that may have been preventative, preventing any sort of DVT or PE. So maybe at this point, your patient has been diagnosed with either a positive for a DVT or is experiencing a pulmonary embolism. So we do not want to interrupt the heparin infusion with any other medication administration. So what that's really saying is if at all possible, start a second IV or a separate site for the heparin to infuse independently. No IM injections, obviously they're at higher risk for bleeding. Go ahead and get a baseline PTT CBC stat if there hasn't been one done in the last 24 hours. You do not need to wait for that result. We just need to get a baseline. Obviously, we're going to run a hemoglobin and platelet count for the next 3 days to make sure that they're doing okay, not bleeding, and having coags, so they could clot if they needed to. All right, so your orders here begin here. Your first order of business here is to begin the bolus dose, which is 80 units per kilogram on initiation. And this is all going to be given IV push at this point. So we're going to do a calculation for our patient who is 70 kilograms. So we're going to say it's 9 a.m. and we've had our patient diagnosed and we're going to initiate the orders. So our orders are to begin. So we have a fresh IV, an IV site, and it's got a J loop and it's just ready to go ahead and give an IV push bolus. We have to do a calculation to figure out how many 80 units per kilogram is. Here's our math on that. 80 units times 70 kilograms, pretty simple, don't make this harder than it needs to be, is 5,600 unit bolus dose. Well, our vial concentration is a very concentrated vial. It's 10,000 units per 1 ml. That's pretty standard at Unity Point. So to do the math on that, our desire here is 5,600 units. So here's our desire. Our have is 10,000 units per our route is 1 milliliter. So you do the math, 5,600 divided by 10,000 times 1, you get 0.56 milliliter bolus dose. So again, this is going to be in a separate site. This right here is probably the most important takeaway that I hope every student understands about heparin. You really should not need anything larger than a 1 milliliter or a TB syringe to draw up your bolus dose. I just can't stress that enough. It is going to be less than a milliliter. So many times it's 0.46, 0.56, 0.8 at the very most. If your patient is very large, it'll be closer to 1. So kind of a baseline, if you've come with a calculation that's 5 milliliters or 3 milliliters, you've probably made an error. Okay, so this is 0.56 milliliter bolus dose. Draw that up in your TB syringe and you'll just give that through a push through your J loop. So now your patient has been bolus dosed and you are ready to figure out the calculation for the continuous heparin infusion. So here on your order set, infusion at 18 units per kilogram per hour. So that's pretty simple. We're just going to do our desire over have. So our patient still weighs 70 kilograms, so our order is for 18 units per kilogram per hour. This will be an IV drip. You will use an IV pump 100% of the time. You should never, ever not use a pump for heparin. Math on that, 18 units is your order, 70 kilograms. Multiply those together, and you get 1,200 units. Whoops. So they need 1,260 units per hour. The concentration of the heparin bag is 25,000 units per 250 mLs. So we need to figure out how fast to run the pump per hour. So we know we need 1,260 units per hour. And our concentration of our bag, so that's our desire. Our have is 25,000 units. And our route is, is 250 milliliters. So The math on that, you divide 1,260 by 200 or 25,000 units, multiply it times 250, and you get 12.6. Go ahead and round that up to 13, and you have discovered how many milliliters per hour you program your pump. The IV tubing, you prime that with a heparin bag of, the concentration 25,000 units and 250, and you go ahead and connect that to the J loop that you just bolused. Okay, so then you're going to run your pump, program your pump at 13 milliliters per hour. So this has been done at 9 a.m. Okay, so 6 hours later, PTT 6 hours after the heparin drip has started. We do not want to draw that early. We want to give them a full 6 hours. So it was the bolus was, the drip was started exactly at 9 a.m. So at 3 o'clock p.m., 6 hours after the heparin was started, the PTT result is 51. Your patient still weighs 70 kilograms. So right here, our PTT is 51. So we're going to follow our orders here. And so there's a few things that you need to do once you figure out that. You look for that range, that sliding range falls in here. Obviously it's a little bit low. Our desire for no changes between 67 and 101. So we're a little bit low. So we have to do a couple things. We have to give them another bolus dose of 40 units per kilogram. Additionally, we're going to need to increase our pump rate by 2 units per kilogram per hour. So don't make the mistake of just increasing your pump by 2 cc's an hour. You always have got to factor in the patient's kilograms, and we're going to do that. So does the medication need to be held? No. If it was too high, if your PTT was too high and their bleeding time was, their blood was too thin, we would hold it. That's not the case. It's too low. So is a bolus dose required? Yes, we already determined that we have to give them a 40 unit per kilogram bolus dose. The math on that is 40 units per 70 is 2,800 units. So we've got to figure out with that same concentration of your, the vial that you drew up your first bolus dose, 10,000 units per 1 ml, your desire, we want to give 2,800 units for a bolus dose, or have 10,000 units per 1 ml. So that calculation tells us that we are going to give a 0.28 milliliter IV push bolus dose. You're going to use that same TB syringe, and it kind of makes me feel better because our first bolus dose was double that, and it was 80. So that tells me, my math is is going to be correct. So we give that bolus dose. Now we have to worry about how increasing this dose by 2 units per kilogram per hour. So we have to infuse that rate. Yes, by 2 units per kilogram per hour. So our math, 2 units per kilogram, 70 kilograms is our patient. So we need to increase our heparin by 140 units per hour. Now we have to figure out how many milliliters per hour to increase the pump. And again, don't make this harder. It's just another desire over have. Our desire, we need 140 units. Concentration of that bag is 25,000 units in 250. So we are going to increase our pump rate by 1 milliliter per hour. It was at 13 at 3 p.m. when we've done our kept bolus dose and our change. When we leave at 3 p.m., our pump rate should just be at 14 milliliters per hour. So then 6 hours later, that should be at 9 p.m. is where we're going to do another PTT. We're going to keep doing these PTTs every 6 hours until we have 2 consecutive PTTs that are in the normal range. After that, we can just check that PTT every morning. Okay? Usually you have to make a couple adjustments until you find your zone for your patient. So 6 hours after any dose change, we're going to do another PTT. So here it is, 9 a.m. The bolus dose was given, so at 3 p.m., sorry about that, I had a little error on my slide. So 6 hours later, it is now 9 p.m. Your PTT result is 120. So that is way high. You're at 119 or greater. So we know we're going to need to hold off and, slow this down because our bleeding time is too fast. So we're at 119. No bolus. We do not want to give our patient a bolus. Is the bolus required? No, because our bleeding time is too fast. What are we going to need to do? Does the infusion rate need to be adjusted? Absolutely. Do we need to hold that? Yes. So we follow our orders. No bolus dose. Absolutely, we're not going to give them more heparin. However, dose change, we are going to hold 1 hour. So we go ahead and just turn that pump off for 1 hour and hold that medication and don't administer it. 1 hour later, we need to decrease that rate by 3 units per kilogram per hour. And again, that's not 3 cc's per hour. We have got to factor in the kilograms. So we need to, after holding 1 hour, now we are at the point where we need to decrease by 3 units per kilogram per hour. So we're going to do the math on that. 3 units per 70 kilograms. We need to decrease our pump by 210 units per hour. Now we need to figure out how many milliliters to decrease the pump rate. Again, just a simple desire over have. 210 units by your have is 25,000 units and 250. So we need to decrease our pump by 2.1 milliliters. Go ahead and round that to 2 milliliters per hour. So once we're finished, we were at 14. If you remember that adjustment we made, we had moved from 13 to 14. Now we are going to decrease it to 12 milliliters per hour. So it would be an hour later at, let's say, 10 p.m. We turn that pump back on and run it at 10. Okay. Next PTT should be drawn 6 hours later. Look, my thing's like wrong again. So that's going to, oh, actually it's right, 3 a.m. So we'll go ahead and check that PTT at 3 a.m. So luckily at 3 a.m. our PTT is good. It's in our range. It's at 70. So I am thrilled. I don't have to make no boluses, no changes. And then here we need 2 consecutive PTTs 6 hours apart to be in the normal range. So 9 a.m. the PTT was 80. The next morning the PTT was 95. And so you're going to do, sorry, here we got 3 a.m. PTT was 70. That's your first PTT in the normal range. The second PTT in normal range is 80 at 9 a.m. So we're good. We don't have to make any changes. So then we can go to the next morning. The next morning PTT was 95. I hope this wasn't confusing. I hoped it helped clarify the initiation of that of the heparin infusion DVT-PT or DVT-PE heparin protocol. That is, you bolus dose, you initiate the infusion, and then making adjustments every 6 hours. So we've kind of taken you from the beginning to then, and then how you manage that continuously. So thank you.